Hi, my name is Jacqueline Nguyen, and I will be presenting about Edward Hannan's and New York City's coronary artery bypass graft surgery and its reporting system. Okay, so a little bit about the background information. Coronary artery bypass graft surgery is a surgical intervention to improve blood flow to the heart and is typically necessary surgery if patients suffer from coronary artery disease. Edward Hannan led a project in New York State Department of Health in 1989 and was involved with this program. He was involved in the reporting system for this particular surgery, which was developed in the late 1988. It is a system that provides information regarding the mortality rates for all coronary artery bypass graft surgeries with adjusted survival/mortality rates. The information for the surgery is collected in this database from all hospitals throughout New York. This data is very useful and it's made public for people in the community and policymakers to evaluate hospital results. The quality reporting is unknown, and there's no way to discover the full extent of the quality care that was received or differences in case severity when it came to patients that were put to undergo the surgery, so the reporting is very subjective. The importance of the system, regardless, is vital for hospitals and public knowledge to provide as a measure of quality care and to improve on this data. So the current situation is there's a problem in the vast variations of patient outcomes and conditions. There is no way to determine the range if the quality of care or difference in the severity of their conditions affected how the surgical result was. So strengths in the reporting system is it puts pressure on all their hospitals to compete and to improve quality of care with patients. And it also encompasses the idea of surveillance and monitoring to improve healthcare performance and better the results for each surgical case. So a weakness is um, presented in weakness presented is not accurate information that can be recorded, and there may be risk associated with data entry bias. But also acquiring and collecting this data would provide a demographic profile of a hospital. Opportunities to improve the system can be made necessary changes in healthcare from prior knowledge of how certain cases of surgery went and how to adjust to successfully complete the surgery with low death rates. There's also room of growth for other states to follow to reporting systems. Studies show release of healthcare results will put pressure on these hospitals to improve their performance. Threats to this system is the controversy many people have if information is made public. They believe that it's an invasion of patient privacy. So number 3, prioritizing issues. There should be campaigns to increase awareness and educate individuals to support measures of the reporting system. Policy and healthcare providers should cooperate to improve the quality of healthcare on hospitals that are performing poorly compared to local hospitals. Advocating to public and explaining the benefits of a reporting system will help the quality of care. If more individuals are more aware of its benefits, then more people would be more inclined to help inform the community to play a more active role to seek for healthcare improvement in this current field. Okay. Analyzing alternatives. There should be a movement to campaign for public reporting systems for many states, including reporting systems for other surgeries besides coronary artery bypass graft surgery. Information that is publicized to increase validity and sharpens its focus to improve hospital care. Other states, after New York's example, follow the public release of information. States such as California, Florida, Massachusetts, and New Jersey also began to go and release this data. And today, New York remains to be a leader in reporting and releasing public information. There should also be conferences to evaluate cases that could have been approached better or differently to provide a better outcome for the patient. Recommendations are passing healthcare measures that would require healthcare providers to follow up a code, like follow up standards in different regions. If there are lobbying events to increase the awareness and need for monitoring surveillance for healthcare services is vital. Advocates for conferences to improve methods on surgical strategies is also very important, and ensuring checkups to improve the accuracy of a report would be very important to go and improve patient care. So the action plan would be to pass healthcare measures in various states to enforce accurate recording of coronary artery bypass graft surgeries or other surgeries and include lobbying if necessary. I believe it would be reasonable to push for this bill within the next 6 years. Final thoughts would be I think healthcare reporting systems is a good example that follows one of the principles of healthcare, which is surveillance and monitoring. Surveillance and monitoring can be one of the many paths to improve quality and patient safety. Thank you.